Good morning, good afternoon, good evening, family. Thank you so much for joining us here on Facebook within the Symptomatic Sickle Cell Trait Global Voices United. And I'm joined by Lee Wilson, all the way from Sacramento, California. And I'm joined by Grace Bruce as well, all the way from Atlanta, Georgia. So I am so blessed to be here with you guys, and it's an honor to meet you again for Grace, because we had a brief discussion in one of our earlier chats, and Lee, to actually finally meet you face to face, because we've been discussing things for a while about having a chat. So yes, I hope I said good morning, good afternoon, good evening to everyone wherever you're based. And thank you for joining us for this discussion. So I have a brief introduction, because I don't want to take up too much time introducing my first guest. So I want to introduce the story today is very informal. We're going to have a bit of a chit chat, hear about Grace's story and a bit about Lee's story as well, and just a brief overview of who I am. So I am Moa Pemila, and I formed this group after suffering the worst sickle cell trait crisis of my life in 2020. It left me physically disabled from a course of 3 months from head to toe. And afterwards, I was having stroke symptoms the duration of the year. This was in June. From March onwards, I began having chronic headaches, but from June till September, I was in this major crisis. I was told so frequently by doctors that it's very rare for carriers to suffer symptoms. And I was told by a nurse practitioner, an advanced nurse practitioner, that we don't know much about sickle cell or sickle cell traits. So they didn't really treat me with anything. And in crisis, anyone who's been through a crisis as a carrier, full-blown or carrier, boy, that pain is just, it's another level of pain. And I was given paracetamol and cocodamol, but a very low dosage of cocodamol, when I later found out in the December. And then going through stroke, and then having complication after complication with my whole body. It's been a long journey, but I'm doing a lot better managing myself now. And here we are. It's now to help these discussions. It's to help all of us how to live better, how to learn from each other, with each other. And we're holding hands literally from a global platform. So yeah, that's enough about me. I just want to introduce my beautiful guest today as well. So um, Grace is on first, and this is a little brief intro to who she is. She's a sickle cell trait carrier and a social services worker, and her background is helping other people. Her main concerns have been advocating for herself, because that's the hardest thing, especially when you're ignored and disbelieved and fobbed off by those who are sworn to help us in the medical world. And as many of us have come to find out, that there's so many doctors and medics who are very dismissive. Not everyone is, but the ones that are, it makes you feel really alone and very isolated. So Grace's concerns are the lack of resources and research available to carriers of the sickle cell trait gene who are symptomatic. As she's found out, trying to advocate for herself, it has gone ignored. Although we recognize, and Grace has recognized, that not all health issues are connected with the trait, some are a direct result of it. So she's here to share her story and empower others who may be symptomatic to not always assume that the trait is benign, as we've often been taught. So Grace, warmest of welcomes to you, and please go ahead and share a bit about your story. And I'll mute myself, so at least you can share, and then I'll unmute as we join in. In fact, I'll introduce Lee as well, who Lee is. Lee is based in Sacramento, California. She's a mother and grandmother. She raised her 3 children as a single parent following a divorce, whilst building her career in employer insurance and reinsurance. her job required travel, quite a bit of travel. So she's lived and traveled all over the USA and even visited London, UK, which we had a brief discussion about the other day, which was really interesting. Um, Lee feels lucky that she's not suffered pain crises that others with sickle cell trait have, but she has experienced one sickling event that she can recall as a result of a CAT scan dye and having an adverse reaction. And then she following which she was diagnosed at age 67. And then having further testing, she was diagnosed with chilblain lupus erythematosus. I think I'm saying that right. Which is a rare and unreported illness. And from then on, her research into sickle cell trait began. And Lee's very well versed on sickle cell trait from her own research, as many of us have had to, find out ourselves. So welcome to you as well, Lee. I'm really happy that both of you could join us. And yeah, now I will be quiet and let Grace share your story.
Okay. Hello, everyone. I would say my story began when I was younger. I was diagnosed as a baby. I was born in Accra, Ghana, but I was raised in Connecticut, and I'm currently living in Georgia. But my story began when I was younger. I used to be a gymnast, so I do a lot of working out, and I ran track as well. So I would experience pains, aches and pains, but I never attributed it to sickle cell trait, and either did anybody else, although we were aware that I had the trait. So subsequently going on and being athletic, when I was performing in athletics, I would feel, as I said, aches and pains. When I hadn't hydrated enough, it was the type of pain that it just didn't result in feeling it then. It would go on like an aftermath. I just figured, okay, hard workout, hard day at the gym, so to speak. Never thought much about it, but it was always that lack of hydration, that would really send me into problems. Never correlated it. So moving forward, as I was getting older and older, I started still continuing to feel aches and pains, and I would go to the doctor. Comes to find out I have anemia and other things, but again, never really related. So I come today to kind of talk about, when going to the doctor, the more knowledge you have about your sickle cell trait and not just assuming that it's always benign, will help empower you to understand what could be going on with your body. Okay, so for an example, I also have like low ferritin, and which means anemia sometimes, if you have that as well associated with it, meaning your body's not getting oxygenated enough, which is going to tire you out. For example, if you don't have that type of knowledge, you wouldn't associate that with the trait. So a lot of people always say, "Oh, I'm benign. Nothing's wrong with me." But my thing becomes, there really isn't enough, in my opinion, research from a lot of the people that suffer from it to say this is attributed or this is not. 100%. Then I'm moving forward with also I have, advanced stage issues with my eyes. When I went to the eye doctor, I didn't associate that at all with sickle cell trait, but he came out and asked me, "Are you a sickle cell trait carrier?" And I was shocked. And I said, "Yes." "Why?" He said, "Because I have other patients that are sickle cell trait carriers as well, and they also suffer from the same type of eye issues that I'm seeing from you." And I thought to myself, well, that's interesting, because I would have never associated that. So there goes another point where, if there was sort of more research in the database, I would have known, because I'm guilty of it. I should have been going to the eye doctor every year, but I didn't pay any attention to it. I was just like, dry eye from the computer, because at work, I'm on the computer constantly. Wow. I didn't associate that. So, my point goes to speak to, if there was more of a pool of the many people that have sickle cell trait, if there was sort of like a database that says they need to be screened for eye issues, they need to be screened for anemia, low ferritin, muscle aches and pains, might not just be that. It could also be that, you're having muscle deterioration because of et cetera, et cetera, et cetera. So if the symptoms were all pulled together, you'd have more of something to look at and say, when these patients present, they need to be tracked for A, B, C, D, E, instead of just always saying the trait is benign. So then I fast forward to how can you advocate for yourself under those situations when you're going to doctors that just believe it's benign or that don't have the research to deal with it. That's a rough one, because even my primary care provider said to me, I don't think any of your issues that you're presenting with is, related to sickle cell trait. I just don't think so. But then as I branch out and I go to my eye doctor, I heard that being said, right?
Information, isn't it, from medical professionals? It's, you kind of think one person knows a bit more and the other person doesn't know a thing. Wow.
Yes, exactly. Yeah. And then with the muscle pain, I had to advocate for going to the neurologist because my B levels are extreme. My B levels are high, really out of range. And then, she's sitting down and she's talking to me because I'm telling her I'm still having this muscle pain. And then she's saying, well, that's related to your sickle cell trait. If you're sickling, okay, that's going to affect blood movement through your body and affect your muscle tissues, etc. So you need to, you need to educate yourself more on that. I'm surprised your primary care doctor didn't talk to you about that, or, you need to go to the hematologist. Okay, well, I wouldn't know all of that because primary care doesn't send you to go there because they don't think that you have any issues.
Yeah.
Even, and then they do the electroparalysis, right? Or I don't know if I'm pronouncing that correctly. That's it. Yes. Yeah. And she says, oh, I results of that. Did they not talk to you about it? I said, no, she just confirmed that I had sickle cell trait, but she didn't talk to me about it at all. And she's saying, well, your levels are high. It's, even though it's, it's indicating, yes, you have sickle cell trait, but sometimes you need to look at the percentage in which you're sickling, that you're able to sickle. And when you have a higher percentage, you are more likely to have pain.
Yeah.
And that's something that you keep presenting with, but nobody's correlating it to that. You need to, you need to be knowledgeable about that.
Yeah. And that's because some of the research out there says, between 20 to 40%. But then I've read other research that said that hemoglobin S carriers tend to have, like, anything over 34% is high. And I mean, mine is almost 40. Mine isn't quite 40, but it's 37.4. So you can imagine the higher, if you're in a crisis situation, it fluctuates and increases. So imagine the higher, it only makes sense that the higher percentage that you have, the more risk, the more symptoms you're prone to possibly suffering or experiencing. And especially the environmental, physiological circumstances that we're told, if we get a good genetics counselor, because Lee shared with us that hers didn't know a thing. So it's like, wow, a lot of medics don't know. I mean, I'm shocked because hearing you share about your eyes, Grace, wow, my eyesight has been deteriorating, but over the past, I've suffered with dry eyes, and my left eye actually tore itself a number of years ago. So because it was that dry, and apparently they don't close properly. But when I mentioned to my eye doctor, and I was looking into sickle cell disease and sickle cell anemia, and looking at eye problems, and there is degeneration with the eyes over a number of years, I kind of started thinking that my eyesight issues and the deterioration, and it's not quite blurry, but yeah, my vision has been affected over the last 4 years, especially since the stroke I had. So that's making me think I really need to go back and have another checkup because, and I really wish, the more of us that speak out, this is great because we're hearing from each other symptoms that we're possibly, you know, are in relation to sickle cell trait. So it's making me think, okay, the more of us that speak out, maybe we should log a database, keep one for ourselves within the group. And then as it climbs and the numbers get higher and higher, we've got something black and white to say, look, we're going through this. We're all from different parts of the globe, but we're all, the common thing is this. And not everything is related, but the things that, we're having similarly, please look into it.
Exactly, because not everybody is asymptomatic, but there are those that are.
Yes.
And they don't need to be, ignored.
Yes.
They absolutely don't, because my eyesight is to the point where he said, look, Grace, I can certify you to drive at this point, but we need to review this again in 6 months because that's how bad it is.
Oh,
And
wow.
and unfortunately is not to scare anybody, but he said that he sees that in a lot of persons that present to him that have the trait, that same sort of dysfunction. And when you're not watching it, it can get worse, but it just takes you watching it to be able to intervene with what, to slow things down. But if we don't have that knowledge to say, oh, this is definitely something that could happen if you're a trait carrier, you may blow it off, but it actually is serious and needs to be looked at.
Definitely. I agree. Wow. And even
Yeah.
mentioning about the muscle aches and pains, I actually had a neurology appointment yesterday and I had a really strange thing go on with my hands over the last crisis I had in was it between, yeah, since the last discussion in, not the last, what month are we in? We're in April, right?
Yeah, we're in April.
Yeah. I think it was between January and then going into March, I had a bad crisis and my menses triggers crisis for me.
Mine as well. Yes. Awful.
Yeah,
Awful.
very
I don't
bad.
even want to mention it.
Yeah.
Awful.
Yeah.
Yes.
I've,
Yes.
I mean, I was having since the stroke, after the stroke, my cycle disappeared during the stroke and then afterwards, it came back, but it didn't stop from September till the following year. And
Wow.
and then it went away after they did a minor operation in the April of that year, 2021. And then it helped temporarily, but then when it came back 6 months later, it just did not stop again for another year. And then it's been on and off like that. And sometimes I would have maybe a 1 day break between, and then I'd think it's stopping and then it would start again. And it was just pouring, like water pouring from me and
Oh
clots.
no.
I was afraid that my organs were falling out at one point. And that's what triggered this crisis that I just had in the end of January, February time. Um, and my hands then went really stiff. And sometimes that happens during a crisis. That's one of the main things that I notice is my skin really hurts, my hands hurt, and but my hands haven't gone back to normal at all this time, even though my body's a lot better than it was, and I'm not in a crisis now. So when you mentioned about the muscle pains, I've had that for years, but it's only clicked yesterday when I went to neurology. I came home and I said to my mom, I should have spoken to him about my leg cramping because I wake up and sometimes I can just turn really gently in bed and my muscles seize up and the cramping, it feels like I'm tearing
Oh,
the muscles.
I feel like you're in my body and saying what's going on. Same thing. And it's
Wow.
so it's I don't even have to tell you, it's extremely painful. It's like
Yeah,
somebody put your leg in a vice grip. That
yeah,
same pressure cup that they may use at, do your blood pressure. It's the same thing. And
yeah.
then sometimes it can travel, sometimes it doesn't, it all depends. But
Wow.
for some people when they're having, their menses, it's stress on their body,
Yeah,
right? And stress
definitely.
can induce what we know,
Yeah.
crisis. So
Mm.
it's all falls into line. And some people would never put one and one together. And that, you
Yeah.
know, and that's exactly what I'm talking about. You just wouldn't correlate it. But actually,
Yes.
you know,
It's very
there's
related.
exactly,
Yeah.
exactly. But
Wow.
if again, if there's no database with information and people's, you know, not results, but you know, symptoms, etc., to
Mm-hmm.
kind of put it all together,
Yeah.
you're not going to necessarily know. You'll put it off to, oh, it's just normal, etc., etc. But for some people, it's debilitating.
Yeah. Yeah.
It's just debilitating, you know, but they just say, oh, I just, you know, some people say it's prostaglandins that are causing your body to contract. But even if that is the case,
Mm-hmm.
it's a stressor. And then it doesn't just necessarily go away when the menses stop. You may
Mm-hmm.
still have a period of time where you need to recover, which is
Yeah.
longer than somebody that doesn't have the trait.
Yeah.
Do you
Definitely.
see what I mean?
Yep.
So
Yeah.
when you present that kind of thing to a doctor and they have no knowledge about it, they're just like, well, whatever, you know,
Yeah.
just, you know,
Thank
I don't have, you understand in that?
you.
Or it's that you're not a person with sickle cell disease. So we're not
Yeah.
really going to talk much further about it.
They minimize you. They minimize it. They kind of almost gaslight you as well because it's dismissed, it's ignored. Your pain is belittled. Um,
Yes.
Lee, what about your experience? Because I know
Yeah.
you said you've only had the one sickling event that you've experienced that you can recall. Come in and share a bit about you.
About that.
Yeah, about
Okay,
your
when I was
story as
when I
well.
was 67, I had to have a CAT scan, and they gave me Omnipac 300.
Mm-hmm.
And on the table, immediately, I started reacting, and I got very, very cold. I'll bet my core temperature went down to the 80s, high 80s. I was
Wow.
shaking uncontrollably. I was dizzy. I had to have a wheelchair and assistance to get me off the table.
Wow.
I
Yep.
said, right after they inserted the needle and I got the initial rush that you're supposed to get,
Mm-hmm.
I completely went to the cold.
Wow.
And I told him, I said, you need to stop this. Something is very wrong here. And he said, oh, no, we're going to go ahead and go. We're going to go ahead and go and finish this. And I said, we need to stop this. So when they finally ended up finishing the CAT scan,
Mm-hmm.
I couldn't get up off the table. I was so dizzy.
Wow.
So they wheeled me into the waiting room, which is where everybody goes. And then
Mm-hmm.
I started to turn blue in my extremities.
Wow.
So I don't think they had ever seen anyone react the way I did,
Mm-hmm.
because all the doctors and all the techs were in front of the room where the CAT scan machine is, and they were having all these little discussions, and they
Wow.
kept pushing water at me. So that started some very intensive research on my part, because at that point in time, I did not know I had sickle cell trait.
Wow.
Okay. Okay.
Okay.
Okay.
I
Okay.
discovered the sickle
Oh,
cell trait by doing genetics at 67. The CAT
wow.
scan dye was done at 66.
Mm-hmm.
I had very bad reactions to two different thyroid meds. And despite all the emails I sent to the doctors, they didn't want to do anything. The
Wow.
reason I did the genetics was because once they put me on a hypoallergenic thyroid med, which they were the only thing I was taking,
Mm-hmm.
all of my reactions stopped and they haven't resurfaced.
Mm-hmm.
So I told those doctors at that point, I said, something has to be doing this. It has to be the excipients in these meds. So
Mm-hmm.
I developed a watch list for excipients after that.
Wow.
And I kind of check, I have to check every medication I'm given. I have to check the manufacturer. I have to look up the ingredients.
Mm-hmm.
Otherwise, what my research has suggested is that once you have reacted to something like that,
Mm-hmm.
the probability that you may react to it again is increased.
Wow.
So I'm like, so that's what I do now. I check
Yeah.
every medication that I'm given.
Mm-hmm.
Good.
I'm
Good.
a little bit luckier than most of you because I had a completely unremarkable medical history till I turned 65 and all those reactions started happening.
Wow.
In terms of the eye thing, I'll go ahead and delve on that a little bit. I have antiphospholipid syndrome, which is a blood clotting disorder. That was diagnosed at 67 and 68, 67, or 68 and 69. And it's a course of labs over a 12-week period that need to be done.
Wow.
I'm going to interject this here because I think that more people with sickle cell trait or sickle cell disease may also have this, because antiphospholipid syndrome is considered a rare autoimmune disease order.
Wow.
And it's primarily diagnosed during childbearing years due to miscarriages, multiple miscarriages.
Wow.
APS and sickle cell trait share some of the same, I'm not sure of the right word, share some of the same things that can happen in terms of blood vessels. All right, so the APS is a coagulation disorder. Sickle cell trait is a sickling of the blood cells. Both exist inside the blood cell itself.
Yes.
So a couple of years ago, I started having sporadic double vision. All right, very intermittent. And I didn't do anything about it for a while because one of the reactions that I had to the thyroid meds was all kinds of eye problems. I had been diagnosed with dry eye, I don't know, 10 years ago or so. But that was primarily because I've worn hard contact lenses since I was 10.
Wow. Okay.
So in order to see, I was referred to a neuro-ophthalmologist. He wouldn't see me without having an MRI. He ordered an orbit MRI, and because of my reactions to the CAT scan dye, I wanted to avoid the gadolinium, which is the dye they use for an MRI. So I'm going to interject this just for general knowledge. Most people have MRIs done on a 1.5 machine, which often requires contrast.
Yeah.
If you have it done on a 3T machine, most of the time you don't need contrast. So I finally found out that I had access to two 3T machines, and none of my doctors knew that we had those machines or access to them, because when I asked for alternatives, they said there aren't any.
Wow.
So I sent back messages to make sure that the neuro-ophthalmologist would accept a 3T, and he said, yeah, that's fine. So what I was diagnosed with ultimately for that was fourth cranial nerve palsy, primarily due to APS and sickle cell trait with possible microvascular changes.
Wow.
Wow. Vascular changes. That's incredible, because even I didn't mention as well, I have venous insufficiency, and that vascular, and, that vascular situation is really an issue.
Yeah.
Well, see, when they did the orbit MRI, I have no eye problems. I have no muscle problems. I have no eye problems. I have none of the things that would typically be associated with fourth cranial nerve palsy. And part of that has to do with my age.
Okay.
Because that was done, I was 73 then, I think.
Okay.
So in terms of, I'm going to go back and address the HBS thing a little bit. After I did the genetics, I was told to tell my doctors that I had sickle cell trait. That was advised by the uploads. So I did that. I went to one doctor and I told him I had sickle cell trait, and he put it in my medical records as confirmed.
Okay.
I had to switch PCPs because of something that the first one did, that I said, okay, we're done with him. And went to the second one and said, all right, this doctor put this in as confirmed. I said, and I don't consider a verbal statement as having been confirmed.
Of course.
There's no confirmation. There's no medical confirmation that you guys have.
Yeah.
So I want the blood test to see what's going on so that you can actually say that it's been confirmed that I have sickle cell trait.
Mm-hmm.
So I had the electro, whatever it is.
Yeah, electrophoresis.
My HBS hovered just under 40%.
Wow.
Mhm.
Now, what I find interesting about that is I don't really have any pain issues
Mm-hmm.
or those things that are associated with sickle cell trait per se.
Mm-hmm.
I recently had a 3-week period where I had a dull constant pain in my upper right heel and the iliac crest.
Mm-hmm.
My doctors seem to be receptive to the fact that they're willing to look at ruling out things in order to go ahead and go forward. And I think sometimes that's important. You need to have some of these tests to rule things out. And I don't know that happens enough.
Mm-hmm.
Because once people say or think that they have sickle cell trait or sickle cell disease, lots of things get attributed to that.
Mm-hmm. Mm-hmm.
So I'm going to have an x-ray of my hip so that we can rule out like arthritis and stuff like that.
Mm-hmm.
And I told him when we were having this discussion, because I had my wellness Medicare exam, I said, well, it could be the APS, it could be the sickle cell trait, or it could be something else. I said, but it doesn't feel like arthritis.
Mm-hmm.
So we'll have the x-ray and we'll see what that has, see what that comes up with.
Mm-hmm.
My hematologist uses me as a myth buster.
Mm-hmm.
And I don't mind him doing that because I think it needs to be done.
Absolutely. Absolutely.
All right.
Yes.
My none of my doctors are Caucasian. Let me interject that too, because I think that may be important.
Mm-hmm.
Most of my doctors are foreign born or from or US first or second generation.
Mm-hmm.
Okay.
So I have my hematologist is Lebanese, and he did his residency and something else at the University of Arkansas. So he's seen plenty of sickle cell.
Mm-hmm.
My nephrologist that I had one patient with sickle cell disease,
Mm-hmm.
no one with APS.
Okay.
And I know that I'm the only patient that any of my doctors have with that combination. It's extremely rare.
Mm-hmm.
But because APS does some of the same things that sickle cell trait does, and can cause some of the same things, like strokes, like hemorrhages, like things like that, or miscarriages.
Yeah.
I wonder if some people who experience some of those issues are not tested further. I know that's the case for APS.
Mm-hmm. Mm-hmm.
Can you what is that? What does APS, can you spell that out for me? What exactly does APS stand for? One more time.
Antiphospholipid syndrome.
Okay.
Okay.
And is it genetics testing you need for that as well? Or
No,
is
it's a blood test.
Okay.
I'll send you the information that you need to have.
Okay, that's helpful.
Okay. Yeah, and then forward it to me too. I'd like to.
Both of them can cause microvascular changes.
Wow. Okay.
Both of them will present slightly differently.
Uh-huh.
One of the things that came out of my MRI was the radiologist who read the report, I'm absolutely convinced, had no idea what APS was, because her differentials indicated MS, multiple sclerosis. All right. And a chronic infarct in an area that would be highly unusual because of abundant blood supply.
Wow. Okay.
So when I went to see my neuro-ophthalmologist about my double vision, I had written up in my iPhone, all right, in the notes section, a bunch of things because I was trying to help him figure out what might be going on. And I was addressing the sickle cell trait and the APS. And once he got done reading that, he said, well, you've made my life a whole lot easier because I think that it may be attributable to one, both, or the other.
Yeah. Yeah. And
so that's where I got that diagnosis.
Yeah. People don't realize that comorbidity as well can affect your sickle cell trait. So if there's something else going on, you know, together, they can be a pretty lethal combination.
Yeah, well,
Or
I think that has to do with why I reacted the way I did to the CAT scan dye. And to date, no doctor has been able to shed any light on that.
Wow. Yeah.
My hematologist thinks it might have been a methemoglobin reaction, but I don't think so once I looked that stuff up, because the methemoglobin is a different kind of reaction. I think it was a sickle cell crisis.
Yeah.
Mainly because I got so cold and I was so shaky and I turned blue.
That's what happens to me. I've not turned blue, but the cold, whenever I have a crisis, I feel like I'm cold inside my bones. And it can be that, I mean, I'm having a fever, but my bones themselves feel like ice, and it feels like a knife is being injected and stabbed. Sometimes it feels like somebody's hacking at my bones repeatedly over a period of time when I'm having a crisis. Yeah.
Well, I didn't have any of that. I think what it had to do with was strictly with my blood. And I think it had to do with the osmolarity and osmodality of the drug itself, because it didn't affect anything like in my marrow or my bones. I just got so cold I was shaking everywhere.
Lee, is your
hot blankets, tons of hot blankets.
Yeah.
Lee, is your osmolality usually low on blood tests?
I don't think it's ever been tested.
See, and mine hasn't. It's been low. So to hear you say this, yeah, and can not just once or twice, but I'm talking about years, constantly. It's, you know.
Wow.
Well, I think when you have these insults, I think your body reacts to it and it tries to make it better. All right. What I kind of don't understand, and I think that there's more to it than just having sickle cell trait or sickle cell disease, is that if my HBS hovers just under 40%, and I'm pretty much asymptomatic for everything that I've been diagnosed with, it makes no sense to me. So to me, there needs to be something else going on genetically that helps with all of those things, unless there's an insult.
Wow.
Okay.
That's my theory.
Lee, when you go to the doctor and you're asking these questions, do they take you as a partner in this, or how is it? How do they respond to you as you've done so much research? What is their response to you? Do they feel like you're a partner?
Well,
do
my
you feel
PCP, okay. This is kind of where getting into the doctor thing started, with this set of doctors that I've had since 2020.
Okay.
I have what I consider now to be an embedded E. coli UTI.
Okay.
Which is the urinary tract infection. All right. And I had my first one at 65, which in and of itself is unusual. And I had 2 back to back as part of my reactions, I think, to the thyroid meds. So I think what happened with those thyroid meds is I told the doctors at that point, I said, I think my immune system has gone to war.
Yeah.
Because of all the reactions that I had. And it was a cascade of bodily reactions. So when I go in and talk to the doctors, these doctors now, and I talk to my PCP about my urinary tract infections and what might be causing that. By then, I had done a whole bunch of research. And if one only has E. coli UTIs and doesn't necessarily present with the normal UTI symptoms, it may be related to sickle cell trait.
Wow.
So I sent him a whole bunch of research that I did in emails. All right. The first urologist that I had that I sent that to said, no, it can't be that. So off he went of the line. And when I saw my hematologist, I asked him for another one, and he gave me another urologist to go see. So I see him now. But what I learned from that experience with my first round of doctors for 2 years in my first Medicare plan was, if something doesn't feel right and a doctor won't listen to me, I move on to the next one. because I will never go through what I did those 2 years again.
Did you stay within the same system? So in other words, for example, if you go to like one system, I'll just call out a name because it's here in Georgia, Emory system. Is it an Emory hematologist and then an Emory rheumatologist and Emory primary care?
My Medicare plan in Sacramento is kind of different in that Kaiser basically controls Sacramento. All right, that's not going to mean anything to a lot of people, but it will to you.
Yeah.
The second thing that ends up happening is the second largest one is Blue Cross.
Yeah. Yes.
All right, and then there's Sutter Alignment. Alignment is out of Texas. All right, and Alignment contracts with Sutter. Sutter is a huge hospital system in Sacramento.
Okay.
So I have access to the entire Sutter doctor base.
Okay. But my question comes in where some doctors will write notes and then the next doctor you see is able to read it. And it may say something like, this person presents with a lot of complaints. I recommended an antidepressant, as if that's going to take care of everything. So one doctor will read what another one has written and they're going like, for lack of better words, this person just is off.
Yeah.
They need antidepressants, you know, that kind of thing.
Head.
Exactly. And that's why I asked you that, Lee, because I was thinking myself, well, if she's going to
well, here's see, I'm so far out of the bell curve for normal protocol. All right. And I mean, I'm really outside the bell curve.
And it's documented, yes.
Yes, and it's documented that I am. Yes. So I don't deal with a lot of that. All right. Like when I had my Medicare, my wellness exam, and I was telling him about the pain in my hip.
Yes.
All right. He was asking me the protocol questions about, you know, going around and, you know, into your front and in your back and stuff like that. And my answer to him was, we know how far outside the bell curve I am, so I don't know that that's necessarily applicable to me.
Okay.
I have no symptoms for Hashimoto's or hypothyroidism unless I'm over medicated. I have presented none of the clinical symptoms for APS, with the exception of the double vision, which is linked but not part of the diagnostic criteria. My biopsy came back with CLE, which after 5 years of having acrocyanosis and Raynaud's tossed around, that was a result of the CAT scan dye reaction, because I started turning blue in the same areas. The timeline is too good. I started turning blue very sporadically over the next 5 years in the same areas that I turned blue in right after the administration of the CAT scan dye. So my rheumatologist saw my toes, and by then I knew I didn't profile for either acrocyanosis or Raynaud's. And I knew it had to be something else, but nobody knew what it was. So she ordered a lower limb ultrasound and a biopsy, a toe biopsy. That came back with CLE, which is, I'm not going to say this right, cristaceous lupus erythematosus, which is a form of skin lupus.
Yeah.
My rheumatologist thinks I have some sort of lupus related stuff going on, but I continually test negative for any lupus. I have no symptoms for lupus.
So do you reckon they've done like a misdiagnosis somehow?
I'm sorry, what?
Do you reckon that there's a misdiagnosis that's going on as well then?
I didn't get that.
Do you reckon there's a misdiagnosis that has gone on? Because how can they have confirmed that there's a form of lupus, but then you're testing negative for it?
Well, I have discoid lupus too. Discoid lupus, these are skin-related lupus diseases. They affect no internal organs.
Okay.
But did they rule out mixed connective tissue?
Oh yeah, no, I carry that diagnosis. I've carried that diagnosis for 5 years.
Oh, I thought so, because some of what you're saying. Yeah,
I've carried that diagnosis since I was 65, because I would have these sporadic back pains,
Mm.
lumbar back pains.
Mm-hmm. Yes, yes. But you know, some of that exactly, the back pains, muscle aches, joint pain.
Yeah.
And my daughter has sickle cell trait as well, but she also has mixed connective tissue disease. So
Well,
some of those
mixed connective tissue
correlations.
disease, from what I've read, is kind of a catch-all because they don't know what's going on.
Well, yeah, for some, but for her, they know she's got Raynaud's as well, you know, and that's
does she have Raynaud's?
She absolutely real bad, and you know,
I have some helpful hints for you then.
I'm listening. Yeah.
All right. Have her wear either merino wool socks or alpaca socks. I actually prefer the alpaca socks.
Wow.
They're a little on the high end, but because they're antibacterial and they're moisture wicking, you can wear them multiple days. So it kind of offsets the cost. And I can send you some brands that you might consider if you want to.
Yeah, send me all of that information, anything that can help her along the way, you know, with this. That would be great.
Okay.
Yes.
And my rheumatologist finally asked me, because my toes would turn blue. My toes would turn blue. This is why they thought I had Raynaud's. My toes would turn blue. All right. But they would turn this purplish blue color. And then that would start roughly, and mine is completely temperature related. So when the ambient temperature is 70 degrees or less, all right, my toes will start turning blue. And then sometime in mid-March to mid-April, my big toes would peel. Yes. I never had Julie Blaine's. I never had any of that other stuff. They would just literally peel. I can send you pictures of that too.
Please do. Send it, please. Yes. So now I'm wondering, sorry, go ahead, Mwap, go ahead.
Oh, I'm thinking.
So the other thing that I did is I ended up I bought a thermal thermometer, and I bought some temperature changing nail polish, which I put on my toes. Because if they're cold, they turn a different color.
And then, yes.
And that's a good indication to me, like when I get up in the morning, before I actually end up getting dressed, then I know, like, do I do the heavy fur boots, or can I do the lighter fur boots? Or
yes. What were you getting ready to say? I'm sorry, I didn't.
No, I was just thinking it's helpful to know, because I think my mom, she's not been diagnosed, and she's of the older African generation that doesn't like kind of looking at things. So I think the sickle cell trait on my side is from her, because there's family members that have also got sickle cell trait and have been symptomatic, and I kind of think it's on her side, but I think that's how I got it. But with the Raynaud's, I think she also suffers with that, because she's quite light-skinned as well, and her fingers turn pale, so pale that they almost go purple. So it's
yes.
Well, one of the trademarks for Raynaud's is they turn flag colors: red, purple, and white.
Yeah.
Okay. Yeah. Now on Black people, it may be harder to see those color changes, but on white people, it's very noticeable.
My mom's real light skin, so she's kind of slightly darker than me. I think I'm lighter than her in complexion, but I look more black than she does in, I think, feature wise. But she's lighter than me, but you can definitely see it on her fingers.
How does she react to stress? Because I know for mine, you know, if she's stressed out, you know, if you can imagine going like that, tensing up.
Well, the stress causes your blood vessels to restrict.
Yes, exactly. And when you have sickle cell trait and your blood is
so if you have sickle cell trait and you're stressed and your blood is starting to and your blood vessels are starting to constrict, it's going to make it more difficult for any blood to flow, and that will cause the color changes.
And a crisis, symptomatic.
And possibly a crisis.
Yeah. For me,
Yes.
I know that that's been a major thing over the last 4 years. In fact, I'd say over the last 10 years, I noticed that as I'd get more stressed, I mean, I guess my whole life, whenever I was stressed, I'd have symptoms, but I wouldn't necessarily have a major crisis until the last 10 or so years. And then with blood pressure issues, um, which again is genetic, it's, it's running in the family. So I'm like, okay, well, my blood pressure kind of goes like this. And when my blood pressure is bad, it triggers all sorts of issues, and then crisis comes on. Um, and it's just everything combined. It's just like, wow, you
Is your
know,
pressure high or low?
it gets really high. It gets
It's
really,
real high.
yeah.
Okay.
My mom's the
Okay.
same, whereas she gets really, I mean, she sometimes has been living with hypertensive crisis, emergency level hypertensive crisis, but she tends to prefer holistic remedies and, home-based remedies rather than the doctors,
I
because
would look into what she's eating. That's
we
what I
we're,
would suggest.
we're all eating, we live together. So like I've looked into foods and we've changed diet. I mean, from having a lot of oil, a lot of our foods, a lot of African cooking was like, can be oily when frying food. So we kind of
Mhm.
bake things, more salads now, more fruits and veg, more oily fish.
Well,
Um,
if you're going to use any oils, use avocado oil, which has a high smoke point.
yeah.
All right. Or use olive oil, which has a lower smoke point.
Mm-hmm.
Both of those are good basically for your cardiovascular system.
Yeah. Yeah.
None of the others are.
Yes. Yeah,
Mhm.
definitely. But also the stress levels as well, because we went through some traumatic stuff. And since then is when I noticed her blood pressure was just constantly high after that.
Yeah, see, I'm
Um,
the opposite. I have what one of the things they wanted to do, or the rheumatologist wanted to do with me when they got diagnosed with the CLE from the biopsy, was she wanted to put me on a calcium channel blocker. And I
okay.
didn't want to do that because my blood pressure, unless I'm doing my white coat syndrome thing,
Uh-huh.
okay, is normal to low.
Mm-hmm.
Mine as well. Low.
So I did not want a calcium channel blocker because I was concerned that it would go too low.
Yeah.
So I researched for some topicals for my toes, which I haven't had to use,
Mm-hmm.
but you can get topicals instead of doing these channel blockers for
Mm-hmm.
things like Renalds and Chili Blains and stuff like that, that basically do the same thing
Mm-hmm.
because they're vasodilators.
Yes. Wow.
Okay. I'm this is off of the topic a little bit, but I have a question.
Mm-hmm.
If either of you have children, when they were born, did any of them have jaundice?
No,
I
No
was
jaundice?
at birth. I was actually
I
jaundiced.
had 3 and no jaundice.
Okay. And you were jaundice at birth?
Birth. Yeah.
Okay. Okay.
Yeah.
I
My
don't think
big,
they would have even known about it when I was born.
wow.
Okay. Okay. But your children did not have it, did not.
No, I was born in
Okay.
1950.
Okay. So I'm asking only because, I'm hearing in sickle cell trait that sometimes there's a high level of bilirubin.
Mm-hmm.
And that's, what jaundice is. And I'm just thinking like that also, if let's just say if a newborn when they're born, if they have an extremely high rate, I'm wondering if those are the ones that are going to present with symptoms.
Mm-hmm. I'm not quite sure.
I don't know because there are plenty of Caucasian babies born with jaundice too
Mhm.
that
Are they
don't have
tested?
trait.
Are are
Huh?
are are Caucasian babies tested at birth for
They
sickle
are
cell trait?
now.
They are now. Okay.
Yeah, they
Okay.
are now. They have been since universal testing in the USA started, I think, in 2006 or 2008. I can never remember which one is right.
Mm-hmm.
Okay. Now that gives me another question. Now, since I'm aware that everybody is tested,
Mm-hmm.
will there
No, not
be
everybody is tested. Only newborns are tested.
yes, only so now
And
that yes,
and I
newborns.
would give it a further caveat in that I'm not really positive that all hospitals would test all Caucasian babies.
Gotcha.
Yeah.
Gotcha.
Well,
So
with sickle cell disease. I mean, over in the UK, there's issues with sickle cell disease. I know that most babies are tested. They're supposed to be testing all babies. But I don't know how accurate that information is as well. Because
Well, here in the US, my understanding is they're only tested for trait. All right, they're not tested for any other hemoglobinopathies. All right.
and
Some hospitals may take that further, but it's not a requirement.
Now, are they testing for trait, or are they testing for the electro? I forgot how to pronounce the rest of the word. Which are they testing for?
Well, the electrophoresis is the test.
The electro thing is a different test. They in the USA they only do a heel prick and test.
Yeah,
Oh,
that's what I thought.
Oh,
That's what I thought.
That's the
That's
generic.
what I thought.
That's the generic.
The electro
sickle cell trait in the UK.
Yeah, whatever that is, the electro all right, is only done as a lab blood test.
Okay.
And it takes
a little bit,
and it has a different coding.
And it's a little bit more detailed, right? So it's going to tell you
because it'll break down your HbA, your HbS, your fetal, and one other one.
Which comes to my
fourth one is.
Yes. Yeah, which brings me to that tension. Then you're going to know the amount of percentage that you sickle. So those that are a higher percentage are the ones that probably need to be, followed in, for sure, and screened further for possible symptoms later on.
Yeah, well, that's what I think. But I think going forward, because all babies are supposed to be tested, I think the numbers are going to start changing.
Okay.
All right.
Okay.
And I'm going to liken it to the AIDS epidemic.
Okay.
All right. And by that, what I mean is, as long as AIDS was considered a homosexual disease, all right, people weren't concerned about it. The normal population, the heterosexual population, wasn't concerned about it.
Yes.
Yeah.
As soon as it entered the heterosexual population, you saw a lot of more movement.
Yes. Well, if all babies are going to be tested, will there be a discrepancy in this in terms of we are going to treat the Black children, the Black babies, different than the white babies? What's going to happen down the line?
I'm going to make a broad generalization here. Okay.
Okay.
All right. And it's by no means what I think, but I think this is what happens.
Okay.
We already know statistically that Black women are 3 to 4 times higher rates for maternal death and infant mortality. We already know that.
Yeah.
Okay. So that part has to change.
Yes. Yes, it does.
Past that, all right, once it starts getting recognized that that needs to change and that is actually happening, then I think there will be a domino effect. It may be slow, but I think there will be a domino effect going forward.
I hope so.
But because that doesn't really answer your question. But generally speaking, depending on where one lives and what one has access to in terms of the medical profession, I think that still exists. For instance, that my hematologist who had the doc following him, that had the shadow following him, he was absolutely shocked that I had sickle cell trait.
Yeah. Same like here we had Rochelle Hona, one of our members in this group. She said her doctor was shocked that she said she had sickle cell trait and she's white. That was his horror. He was horrified. He was like, what? And
well, once I had the electro okay. And those results, I had 2, and those results actually sit in my file. No doctor has any question about it.
Wow. So they must have seen others that are from not the typical, what they'd, the stereotypical,
Oh no,
typical.
I don't think that. I know that my nephrologist, I'm the only patient that he has with sickle cell trait. He has
Mm,
one patient with sickle cell disease.
yeah. Wow.
Okay.
So
Wow.
I
that's,
don't think any of my other doctors have anyone. My hematologist has APS, but no sickle cell, and maybe a sickle cell disease. My
yeah.
rheumatologist has neither one.
Uh-huh.
And my PCP, I don't think sees anyone with
Uh-huh.
both.
Okay.
Wow.
Okay.
Yeah. I mean, well, not thankfully, because I haven't got any doctors that I know that have seen other patients with the trait, but I know that, I have friends in Leeds where I'm based, that have trait and they suffer symptoms, maybe not as severe as mine have been, but they suffer very similarly. And quite a lot of doctors, when I've been to hospital, the accident and emergency department, I'd asked this Indian doctor, I said, do you see many trait patients? He said, oh yeah, don't forget it's a broader, there's a wider concentration in the city center of patients that come in. And there's two main hospitals that I know in Leeds. There's one which is a university teaching hospital. It's the Leeds General Infirmary. Yeah, Leeds General Infirmary is just the general one that if you're in near town, you can go to. But then there's the other one, which is St. James's University Teaching Hospital, and I think it was classed. I can't remember if it still is the biggest in Europe. So they have knowledge of sickle cell. They have a specialist hematology center there. However, when my hematologist just dismissed me, he said it's too his reasoning in my letter that I have was, even though I'm well versed on sickle cell trait, and I've been through, things that I've suffered my whole life, he was like, it's too frequent, because I'd say I have one bad episode a year, and that was since the age of 5.
You're not
Uh,
seeing a hematologist anymore?
He's never seen me. He saw me. He spoke to me once, and that was it. And my treatment has been complete shut off. So the mental trauma has been, going through all of this on my own has been the hardest thing ever, because I've never had, and now I understand why my mom hates going to the doctors, because she doesn't trust them. She's never trusted the medics because they've never helped her. Her experiences have been very bad.
You
And
have to do a lot of doc hunting. I mean,
the problem with the UK is that
it's the system, unless you go private.
yeah, and I don't, at the moment, I'm out of work, so I can't even go private for myself. But so the system is horrible. I was told if I can find a doctor in London, which is a 4-hour train ride, a 2.5-hour train ride, 4-hour coach, then I can. But if I'm immobile because I have hip issues now since the major crisis I had, then how am I supposed to sit on a coach for 4 hours and go to see a doctor and say,
Well,
well,
we have a similar problem to what you're experiencing when you get over what is referred to as flyover country in the US.
Mhm. Wow.
All right, as long as you're in more of a major metropolitan area, i.e. like London,
Yeah.
all right, you're
Yeah.
going to have access to better care, generally
Yes,
speaking.
definitely.
All
Mm.
right. Once you get into the areas that are more rural,
Mhm.
that diminishes dramatically, as well as access to hospitalization.
Definitely.
That's my insurance reinsurance side talking.
Yeah, yeah, yeah. You're right. It's 100% right. And he just said to me, well, you have the trait. However, one good thing came out of it is I had a really adverse hospital reaction
But
in
I'm going to interject something. I'm a little surprised at that because I can't remember the hospital that's in London, but it's the doctor who did all the research on APS. And
okay.
I think that there's a related arm to that facility that does sickle cell as well. I'll have to confirm that. I'll have to look that up.
Well, there's the guy in St. Thomas, I think, hospital in London. But because I'm based in Leeds, it's just the fact of me, the hematologist or my GP actually said if I can get them to agree to be referred to them, which means how on earth am I? I mean, if a
Well,
doctor,
I'm wondering, why can't your hematologist call the specialist in London and find things out?
well, he's a specialist for the whole of Yorkshire and Humber, so I'm really screwed. Sorry for my language, but I'm really screwed because my hematologist in Leeds is the specialist for South Yorkshire, which is a huge region, South Yorkshire, Leeds, and Hull and Humber. So if he's the specialist, then I'm kind of like, well, what's the point of going to him because he's not going to see me anyway. So I'm doing it on myself, which
Yeah,
it's it's
it's
tiring, it's exhausting, it's frustrating.
yeah. And
Oh,
myself, I had a
so
referral.
sorry for
Oh, I was going to say
you.
for
Should be able
myself.
to see. You should be able to see a hematologist, and at least in my case, I'm pretty sure that when I have presented some of these things, with the exception of the urologist that said, "Oh no, this isn't. There is no such thing as sickle cell trait with an E. coli UTI," which he went away.
Mm.
But I
I was
think
going to. Oh, sorry. Go ahead.
so. I think that there's something that you should be able to get that better treatment, even if they have to call somebody else, even if they have to research and talk to somebody else. That's just me. And
Yeah.
I would push for that.
And I mean, he's shut me down because I mean he's got the rights. He can just dismiss me and then he's discharged me. And all I do is complain to GPs. That's what I seem to do all the time. So I complain, and that's the only thing. If I complain,
Complaining or advocating for yourself,
yeah,
because I don't want to consider that complaining. I want rather consider that advocating for yourself.
yeah, 100%. And it
And
is.
Well, I think it depends
Yeah,
on the doctor. I think if the doctor perceives it as you being a
difficult.
complaining patient,
Yeah,
they will
well,
end up
and that
labeling you like complaining patient or non-compliant.
right,
yeah.
and then offer you antidepressants. It's
Yeah,
it's just
basically,
it's
yeah. That they'll
yeah,
just kind of shuffle you off into the corner.
yeah.
But
They haven't
But
even offered
I
me the antidepressants. They haven't. So
yeah,
yeah,
but
sorry,
m-
Grace. Go ahead.
what I say is here, I'm in Atlanta. It's a big metropolitan city, right?
well, you have access to Emory.
But well, I have access to Emory. I go to an Emory hematologist who then wanted to transfer me for the sickle cell trait to Grady, which has a sickle cell trait, excuse me, a sickle cell disease clinic. But they said they're not seeing anybody that has the trait. You have to have the full on diagnosis of sickle cell
See,
disease.
that's part of the problem that I think exists. Sickle
Yes,
cell disease has gotten more publicity than
Mm,
sickle
exactly.
cell trait. And
yes,
to
Yeah,
me, that's backwards,
it is
because
because it's the
sickle
root.
cell trait is the result of two people having trait that have children that forms the disease.
Yeah,
And
it starts with the trait.
yeah, it
yeah.
starts with the trait.
It
Hmm.
starts there, and they don't want to acknowledge that there are any issues with it.
Yeah.
Because some people, again, going back to when we first initially started this meeting, some people have symptoms
Yes. Yep.
Well,
and
Definitely.
it's not acknowledged.
Uh-huh.
well,
And
I think I agree that it's not acknowledged. All right.
Mhm,
But I think that it may depend on the doctor and or the facility here in the US,
mhm.
because
I think it's bigger than that, Leaf, because the massive information, if we just go back to the CDC websites, the governing bodies state that if you look at most of the research, it kind of shuts us down from the start because it says most people with the trait generally have a healthy, normal life, or you can't suffer symptoms. And it's like, apart from there's a slight clause which says some people with the trait can experiences, in rare circumstances, crises, but I think it's just a covering their backs kind of thing. Um, because if you
it
look at,
doesn't get enough. Symptomatic sickle cell trait does
Mhm.
not get enough acknowledgement,
Yes,
period.
100,
Right,
yeah,
right. Even though some athletes have actually died because of
right,
it.
yes,
But again,
military
those
personnel,
Yes,
Yep.
yeah,
And
but some of
children.
those,
Yeah.
yes, absolutely. But
Yeah.
some of these athletes are entertaining people, right?
Hmm.
And
Hmm.
they're very good. So we wouldn't want to say that they should have anything that should restrict them from entertaining the masses,
Hmm.
so to speak. Do you
Yeah.
see? Because National, Basketball Association, that's big. That entertains thousands. People love it. So we wouldn't want anything to keep them from continuing to participate
Definitely.
because
Definitely.
it's entertaining, but it can also be serious.
Yeah, definitely.
Obviously,
We've got children in the, well, sadly, parents in the group who've lost their children from complications predominantly present with sickle cell trait and not sickle cell disease. So if
yeah.
that's the case, and it's classed as rare, but yet as soon as I started this group and I said, is anybody else, all I did was do a basic like one finger type, guys, I'm suffering a really major crisis. I can't do much. Bear with me. I'll respond as soon as I can. And that was when my GPs kept telling me, oh, we don't know whether you have sickle cell trait or sickle cell disease, but yet I told them I've had many tests, I've had many issues in the past, constantly being told, sickle cell trait. My mom was told at birth. So me knowing that, them not listening and then delaying my blood test, which they took, and then they said, oh, I said, well, can you do a blood count? They didn't even do the blood count for 4 weeks. That could
Really?
my life. Yeah, they did. They just did a basic sickle cell or sickle cell disease test, and that was basically a basic test. When I phoned back to say, what's my blood count? I began taking supplements. I did as much as I could, taking liquid chlorophyll to build my hemoglobin levels. I just started researching into what can build my blood because I thought if I die, it's on them. And that's why, I wrote my story because I thought I need to leave something behind. I had an amazing genetics counselor who she gave me the information that I needed. She actually told me, she wrote the letter to my GPs to push them to refer me to hematology. And she was like, she knows her stuff about sickle cell. I grew up in a community where, it was predominantly Black Caribbean, African as well. And my immediate neighbors had sickle cell full blown, and they were the ones that said, you're suffering exactly like me. Have these tests. And when I, from the age 8 was when I was really conscious of what I would go through. And my neighbor was, a mom, her children have the trait. One of her children I know has the trait. And it was like, well, I know what I go through. And I just kept quiet. I'd just go into my own bubble, just disappear from the world whenever I was sick, and then go back to as normal as possible when I wasn't. But I knew I was different. But it's cost me being really lonely growing up, really lonely. So it's been a journey, but at least we have each other to kind of to help each other through and take all this information. I'm going to have to listen to all this back again because there's so much valuable info.
Me as well. Yeah.
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 And Lee, you've given us so much to actually look into as well. Things that we can
Yes.
look into, and Grace with the eye thing. Now I'm like, okay, Lee mentioned eye issues as well, dry eyes. And I've had such major issues with my eyes. And then it's just like, wow,
Yeah.
so much.
Yeah.
But it
Yes.
helps that we're not afraid to fight for ourselves, that we are quite from our personalities, we're strong in the fact that we're not going to take it lying down, we're going to fight back.
Well, I think there's another side to that. We can fight and advocate for ourselves, but we need to have a receptive ear.
Yes,
And
100%.
if you don't have that receptive ear,
Yeah,
then
you're
it doesn't matter how much you fight or advocate for yourself. You need to move on to someone else.
yes, 100%. I agree. And that's one of the things I'm grateful for is through this advocacy journey, meeting doctors who are working across the globe, to kind of help us, because I think the more doctors that we find who are finding patients, there's I wanted to mention for World Sickle Cell Day, we're going to have a consultant hematologist join us who I spoke with last week following the last discussion that we had in the group with Dr. Kataria from Salvio Therapeutics. He's a medic and he knows about sickle cell trait in India, presenting with problems. And from Dr. Dipti Jain, she's the consultant. She's doing a lot of research, and she's globally renowned. So I believe, we're making progress. She was like, I'm learning from you, because she said, what tests have you had done? And I said, I have had the electrophoresis initially, and then I went on and had molecular testing as well. And all of that's been done. And she was just really pleased and hearing my symptoms. She said, these are what my patients, they would turn up with the trait and then have treatment as if they're a sickle cell patient, because they didn't have any testing at the time. They needed blood transfusions, which I've never had, even when I was at my lowest hemoglobin levels. So yeah, they turned up, had treatment with her, and then later on they would find out that, oh, they just have trait, but they're presenting in crisis and in need of, the transfusion would resolve their pain, and oxygen and hydration. So she was like, I'm learning from you. So she's, she's willing to work with us and to be a part of this ongoing research, because I think as a global community, if we're all suffering something or we're noticing similarities, there's one common denominator, which is the trait. And if, like you said, having that receptive ear, that makes all the difference, because it's okay. Like we spoke earlier, I think having a doctor that's willing to admit, I don't know it all. I don't know about sickle cell enough to say, it is or it isn't, the trait. However, I'm willing to work with you. Let's work together. Let's learn together, because that's what we're all doing, isn't it? We're learning as we go along. And just, if we can contribute to research, I'm more than happy to do so.
Well, this is my thought, and I've put this out to some sites.
Mm-hmm.
All right. People here in the US get a normal, I think it's a comprehensive medical panel, which does all your blood stuff.
Yeah.
CBC, yeah.
All right. I think that there should be an electrolysis added to that, the electro whatever. All right. It only needs to be done once.
Yeah.
All right. And that will identify the 2 to 3 generations of people, as long as they go to the doctor. All right.
Mm-hmm.
That may be carriers.
Yeah. Definitely.
And at that point, then, that can end up happening. The other thing I think that needs to happen to identify this is that if people are planning on getting married, they should go, particularly if they haven't had the heel prick, they should go and have the electro whatever done, so that they know what their status is. You can also get the same information from doing a genetic test.
Yeah.
All right. Well, and you can pick up a genetic test for like $60, I think, at 23andMe. That's what I did.
Yeah. Well, I know with Black people from Black ethnic groups over here, they do, when family planning, when people are having children or when you're pregnant, especially if they've identified trait in your records. I don't know how general.
I don't think we do that here in the US.
Oh, wow. And yeah, with Black people, especially children, or if they know that you're pregnant.
And I'm not just talking about Black people, because
with
what's
everyone
happening in the US, it's not just the Blacks now, it's the Mexicans, it's the Asians.
Yeah.
It's because of immigration and because of intermarriages.
Yes.
There is going to be more that start showing up.
Yep. 100%. And then also, like we say, there's Caucasians that are from, who knows what's in the bloodline. It's in the bloodline.
Oh, well, mine, here's something for you. Mine is my maternal grandmother's. It goes back generations.
Wow.
All right. And the other kind of interesting thing about it is when I was a little girl, my uncle, my mother's brother, served in the Pacific, and he caught malaria.
Okay.
He came to see us in Boston when I was little, and he had a flare up of the malaria, and he would carry those quinine pills with him. Quinine, right?
Yeah.
And he could take those quinine pills and he was fine within 24 hours.
Wow.
When I started researching malaria and how long it lasts, that's
Mhm.
very unusual. So I'm pretty sure that I got it from my mom because that's my maternal grandmother's side.
Yeah.
But as her brother, he probably also had it. Otherwise, he would have been a lot sicker with malaria.
Yes.
Yep.
100%. Yeah. Sounds,
Yeah.
it makes sense. That's amazing. Really.
Yes.
And none of them ever had any real sickling issues that I'm aware of.
Mhm. Wow. But then again, do many people, because of lack of awareness, a lot of people that do even have milder pains, you know, especially if they're not bedbound with the sickling issues, will they even acknowledge them? Will they even talk about them? And that's,
Well, I don't think back when my mother and uncle were around. I mean, I was born in 1950, and I can tell you from 1950 point forward until probably the 1964 federal laws were passed for discrimination, anti-discrimination.
Mhm.
There wasn't a whole lot going on.
Yeah, yeah.
All right, here.
Hmm.
And
Yeah,
that first generation passed those laws is
yeah.
the first generation that basically was supposed to have quote unquote equal access.
Hmm.
So it's a movement that is slowly getting steamrolled.
Yeah, yeah.
And there's still issues here. I mean, there's still lots of issues here.
Mm, there is. There
And it
is.
depends a lot on where you live.
Yeah, yeah. Where you live, access to transport as well
Yeah.
comes in.
Where you
Yeah.
live, the population that you live with in your community, your
Mhm.
access to healthcare facilities and quality doctors,
Yes,
all of that impacts it.
definitely. Definitely. Wow. Oh my goodness, ladies, this has been interesting, really interesting. And I
Yes.
think we might have to come and do a part two of this discussion because it's far from over. Um,
Yes.
but I think it's been definitely a learning point for me. So
Me as
Yeah,
thank
if
well.
you will send me, Grace, if you will send me your either
you.
phone number or email or whatever, I'll
Yes,
send you some information on Renal's.
I can put it in this chat right now. Would it go in the chat? Let's
I
see.
think so. And there's no one else that I don't
I
think any,
wouldn't put it in the chat because
or
that's
I
too
can
public.
forward it onto you. I can forward it.
Okay.
Yeah.
Yeah, I wouldn't
So
put it
you're
in the
for,
chat. It's too public. You don't know
okay.
who's there.
Watching. Yeah.
Okay. Okay. So you can forward it to Lee for me, Muap. Thank you.
Will do. I will do. Oh, thank you so much, ladies, for joining me. And thank you to anyone who is watching on Facebook. I hope I shared it to the right group. I think I did. It's one of the pages, the symptomatic pages, which are managed by our actual private group, but it's the symptomatic page. So I'm hoping I did the right thing. You can see I'm not always great with that, but yeah, I tried.
Well, I'm just proud of the fact that I got the Zoom right.
Well done. You did good, ladies. Woo,
Yeah.
woo.
All right.
You
All
did
right.
good.
Well,
I wanted
Muap,
I wanted
email
to
me and let me know which platform to find it on so I can write down some of the information I've learned today. I'd
yes,
like to,
I'll
yeah.
tag you. I did share it to the group because I found it in the page and I was following. So I tried to share it to our group. Because I
Great.
think one of them, the symptomatic page that's connected to our group is more open, so people can actually access it a bit more easily. But then the actual group, the private one, is where we tend to do all the live streams, just so that it's, I think, for anyone who doesn't want anything publicized, you know, while they're on camera. But then I do share that, you know, is it okay to share it? I don't on,
Okay.
yeah, yeah. So
Okay.
I'll do
Okay.
that. I just
Thank
wanted
you.
announcements before we say bye. For World Sickle Cell Day event on June
I have
22nd.
to lean in. The dogs are barking.
Oh, bless you. Can you hear okay?
Yeah, I can now as long as I lean in.
Okay. Yes. So World Sickle Cell Day is on the 19th of June, on Juneteenth. However, we're having the event following that on Saturday, 22nd of June at 12 p.m. UK time. So I just kind of wanted to do a shout out to anyone who is a sickle cell trait warrior to come on the Zoom panel We have a number of guests, including our very own Dr. Austin from the Aswan Foundation in Texas, Miss Richie Johnson as well from the Chris C.J. Johnson Foundation. Dr. Kataria from Salvio Therapeutics will be coming back as well. Our very own Dr. David Owoye as well. He's a warrior, but he's a medic and an author and an advocate now for sickle cell trait as well, which is amazing because he heard me immediately when I was going through a crisis that time. And he's been a brother in war. You know, we've been together from the start of this group. So he's amazing. And then Dr. Dipti Jain, who I mentioned, she'll be joining us from India. And I believe my neurologist may join us as well, which is awesome. I don't know if he'll be sharing anything or whether he'll just join the panel just to listen in, but I wanted to invite anyone who is symptomatic to feel free to join us for the actual meeting and just be there and show your face and support. And maybe I'll say who is symptomatic during the discussion. And if we all just stick our hands up and wave, if we can see each other's waves and say, you know, we're symptomatic. And when that happens, I think having the panels of doctors and seeing how many of us are symptomatic or who have had any form of symptoms, whether it's minor to major, you know, I think having that as a number that people can see, you know, just being visible and sharing that, you know, we've suffered and we do suffer, that kind of counts towards our numbers growing and research taking place. You know, we're moving forward. It may be slow, but we are moving. And then I just wanted to update as well very quickly is my story is in production now as an audiobook. So anyone can download that. Hopefully by World Sickle Cell Day should be ready. It's in production, but it is available on Kindle as an ebook as well. And it's also available in paperback, as most people know. This journal, I don't know if you can see it, but can you see this okay?
No, it's
yeah, it went in and out.
Can you see that now?
No.
There we
There,
go.
stop.
Yeah. So this journal, it's 365 pages thick. It's huge. But I created this. It began from me having to carry an A4 lever arch file everywhere I went to see medics because I was literally having to take black and white evidence for them to see. So I created this journal for anyone. It's called Symptomatic, My Chronic Condition Care Plan and Journal. And it's literally a place where you can record. I'll share the pictures of the internal pages to the group because it's got like symptoms, a place for symptoms, pain triggers, medication intake, water intake, pain levels. It's also got a place where you can record your blood oxygen, your sleep hours, quality of sleep. And I do need to include oxygen sats and temperature because I know that that's something that I always know my crisis, but it's for anyone who wants to keep track of what you're going through. There's also like a journal section and reflection section, so you can write as much or as little as you need. But this might help people if they're wanting to have a journal that's specific to chronic pain, chronic issues, and you're struggling to write anywhere else or keep track. That will be available. It's on lulu.com now, but I just ordered my first print and I want to edit slightly. So if anybody wants one, let me know and I can direct you once it's actually been uploaded to Amazon in paperback version. So yeah, it's there to help people if they would like. And also, and this isn't to sell anyone anything, but if you want to advocate for yourselves, these are there. I did it for me and anyone who's interested. I don't know whether, can you see it? Oh,
Going in, yeah, it's going in and out, but yes, can see it now.
sure. And the t-shirt says, so it's basically just to get people to question, do you know the symptoms? Do you know that sickle cell trait isn't benign? And I just thought this is something I would wear to just kind of silently advocate for myself. There's
Yeah.
the armbands, medical ID bands, and the cards as well to say that, you know, if ever you can't speak, this is what I might need. So there's things that we're doing to kind of like push advocacy out there without having to advocate too much, especially if we're tired. So yeah, I just wanted to update all of that to the group. And yeah,
Thank you.
Thank you. Thank you. Thank you so much for being willing to share your stories, both of you, and to join me. And this has been amazing.
You're very welcome.
I hope it was
very,
helpful.
very welcome. Yes.
Very,
Yes.
very helpful, very insightful. And yeah, I'll definitely keep you guys updated on my journey. And please keep me up.
Please do, yeah. Yeah, and also if you can put the link into the program that you were talking about.
Yes.
So we can tab on and be part of that, listen in.
Perfect. Yes, I will. I'm in the planning stages at the moment and getting everybody involved who's going to be attending together, and we're going to have like a WhatsApp group a planning event. But I was also thinking, somebody had mentioned to me that they would like to have like a WhatsApp group. And when I had my business, I do actually have the old line I was using for my business. So there's a potential for a WhatsApp group for the actual Facebook support group. It just depends on maybe at the moment my availability, because I'm learning to drive and I'm coming close to my test. So I want to get that done, and then once that's over, then yes, I can think about having a WhatsApp group and being a bit more present for everyone. But I thought that might be a good thing to have, as a WhatsApp.
Sounds good to me.
Yeah.
Yeah, absolutely. Yes.
Amazing. Yeah. Amazing. Yes. But yeah. Any closing remarks, ladies? Would you like to say anything else?
I would just like to say, advocate for yourself as much as you can. You know, your health is your wealth.
Yes.
And if you've got to educate your physicians along the line, feel empowered to do so.
Yeah, definitely.
I agree with what Grace said.
100%. And I 100% agree with both of you. I think, this has given so much information. So, and there's plenty more in the group. There's, the featured links if people want to access any of the old information, because we were posting a lot of research papers. There's so much in the group. Please utilize that information. I put even my letters from the genetics counselor in there, where she gave, references to the textbooks where it talks about sickle cell trait. There's so many genotypes. So yeah, just advocate loud and proud, and don't be afraid. Don't be afraid to push for genetics testing. If this doctor won't do it, then push for it. Like Lee said, find one who will. In my case, I've found other doctors who are willing to advocate and work with me from global countries, and if needs be, I can always ask if they can come on and actually help us to push for further testing. I'm sure they'd be more than happy to.
Good. Yeah. All right,
ladies. Okay, well, have an amazing afternoon, Grace.
And you Lee, too. You have a good evening to you.
Thank you. Yes, I'm gonna go and just relax a bit, I think, and then I'm gonna do some edits. I've got quite a lot of different projects I'm trying to balance, and but I'm making sure I do it when I'm at rest, if I can, from my bed, if I need to. Yeah.
Make sure you take care. Make sure you take care.
And you too, ladies.
Thank you so much.
Thank
See you all.
All right. See you guys soon.
Bye. Take care. Bye-bye.
Bye.